Hi, my name's Tim. The outdoors can be a lot of fun, but if you get into trouble, like poor old Peter here, you're often a long way from professional medical care. This podcast was designed to teach you how to correctly respond if you should find an unconscious casualty in an outdoor environment such as this. Knowledge and skills presented in this video can help save lives, and so will be useful to anyone participating in outdoor activities. This tutorial emphasises the most fundamental parts of the Expedition Immediate Care Remote First Aid course. Securing the airway. By the end of this video, you should have the knowledge necessary to stabilise unconscious casualties and make sure that they survive until help arrives. Come on, let's go help Pete.
First step of your response to finding an unconscious casualty should be to assess the danger of the situation. Prevent further harm from occurring to yourself and the casualty by approaching cautiously, scanning the area for threats, and removing any that you can from the location. On reaching the casualty, immediately initiate contact for help. Once you are in a suitable position to engage with the casualty, your second step should be to assess their response. This assessment should include several reactive stimuli, including audible, movement, and pain-based responses. If unresponsive, the most crucial next step is to open the casualty's airway. Firmly tilt the casualty's head backwards and lift the chin. This simple action is most often the one that secures unconscious casualties' survival, as it prevents the relaxed tongue from blocking the back of the throat and preventing normal airflow. With the airway opened, you should now check for breathing. This assessment should be made over 10 seconds. Look for chest movement, listen for the sound of breathing, and feel for the air on your cheek. Count the 10 seconds allowed to yourself and record any breaths detected on your fingers. Regular breathing should consist of 2 to 3 breaths over the 10-second assessment. If by following these steps you conclude that your casualty is breathing normally, you should proceed by placing them in the recovery position. This maintains the casualty's airway by keeping it open and clear of fluid and vomit. It allows for constant airway management and drainage. To get the casualty into the recovery position, start by straightening both legs. Then move the arm nearest to you up and outwards with the palm facing up. Bring the far arm across the chest and hold the back of that hand against the cheek. With the other hand, grasp the far leg just above the knee and pull it upwards. Maintaining this position, roll the casualty towards you and onto their side. Proceed by adjusting the position to keep the airway open. From the completed recovery position, the casualty's airway and breathing should be constantly monitored until help arrives. Ambulance services generally locate emergencies using postcodes. For you, this will not be possible, and depending on the remoteness of your location, you may need to request mountain rescue or even a helicopter with a winch. Do not be afraid to ask for exactly what you feel the situation requires, and where possible you must be able to provide a 6-figure grid reference and increase your visibility in order to help rescue teams find you. Whilst waiting for help to arrive, it is important that you insulate your casualty from deteriorating in the outdoor environment. This deterioration mostly occurs through heat loss, and this can be prevented by insulating your casualty from the ground and the air using whatever you have available to you. This principle applies regardless of your environment. Do not be afraid to improvise in order to keep your casualty stable. Dealing with casualties in an outdoor environment places individuals under significant amounts of stress. Operating with high anxiety or physiological arousal can cause a catastrophe effect, causing you to freeze and unable to treat the casualty. In order to operate regardless of stress, you need to be able to reduce your anxiety. Studies have shown this can be done through simple strategies such as slowed exhalation, counting, and self-talk. Employing these strategies prior to commencing treatment with a casualty may help to secure correct application of protocol and thus better promote casualty survival. To become proficient at the skills demonstrated in this video, it is important that you practice them. Varied practice in different environments will aid the learning process, and using whole-part-whole practice will allow individuals to become proficient at separate skills within this protocol while still being able to apply the entire procedure.
So remember, danger, response, airway, breathing. If your casualty is breathing, put them in the recovery position. Insulate them from the environment and constantly monitor their airway. You okay checking his breathing for me? Yeah, no worries. So there we go. Casualty is stabilised, help is hopefully on the way. By following this simple protocol, you can successfully manage the casualty's airway and keep them alive, regardless of the challenging environment. Hope you found this video helpful. And if you remember nothing else, please keep in mind that any casualty, regardless of situation or environment, the priority should always be the airway. Thanks.